before we start applying the spray, before we start actually treating any wound or putting a dressing on any wound, the first thing we have to do is to clean the wound. I think that is very important. Debridement of the wound is most important because we have to get the slough out from the wound, and that is what we do. And after that, it's smooth sailing. It's just spraying this twice a day. That's all, and covering it. Sometimes I cover, sometimes I don't cover. It depends on how big the wound is, whether it's a weeping wound or dry wound. If it is a weeping wound or big lesion, then I just spray it and then cover it with a very light gauze, just to cover so that it won't get scratched or anything like that. And then as we go along, when it becomes dry, I would prefer to leave that wound open and spray it twice a day. That's all you need to. Twice a day, and you can see results.